According to the Centers for Disease Control and Prevention, CDC, over 29% of seniors aged 65 and older in the U.S. are living with diabetes, and even more are pre-diabetic without realizing it. But here's the problem. Many older adults only focus on controlling blood sugar levels, thinking that's the end of the story. Unfortunately, it's just the beginning. Diabetes is far more than just a blood sugar issue. It's a condition that can quietly and dangerously impact your heart, kidneys, eyes, nerves, skin, and more, often without warning. If you or someone you love is a senior living with diabetes, this video could literally be a lifesaver. We're not here to scare you, but to alert you to some critical complications that are often missed until it's too late. And sadly, in many cases, these complications don't come with loud alarms or dramatic symptoms. They creep in slowly, silently damaging vital organs until a crisis strikes. Today, we'll uncover 6 life-threatening conditions every senior diabetic must know about. From silent heart disease to nerve damage and vision loss, we'll explain what to watch out for, how these issues develop, and what simple steps you can take starting today to protect your health. These are real medical alerts that doctors want every senior to understand. Not just when it's already too late and you're in the ER, but right now, while there's still time to prevent them. And don't worry, we'll break down the medical terms into simple language. You don't need to be a doctor to understand how to protect your body. All you need is the right information, and that's what this channel is all about. So, if you've been managing your diabetes with just a pill or an insulin shot and think that's enough, please keep watching. Because what you don't know could be putting your life at risk. These 6 conditions are not rare, they're common, dangerous, and often overlooked. Make sure you stay until the end, where we'll share a 7th alert that ties everything together. Something most people never realize about diabetes, especially as we age. And if you care about your health or someone else's, don't forget to like this video, subscribe, and hit the bell icon so you never miss vital senior health tips like these. Number 1. Diabetic heart disease, the silent killer. When it comes to diabetes, many seniors are surprised to learn that heart disease is the number 1 cause of death among people with diabetes. In fact, according to the American Heart Association, adults with diabetes are 2 to 4 times more likely to die from heart disease than those without it. And here's the truly scary part. Many of these heart conditions develop without any obvious symptoms, especially in older adults. This is why it's often called a silent killer. You may feel fine, walk every day, and think your heart is healthy, all while plaque is quietly building up in your arteries, narrowing blood vessels, and reducing blood flow to your heart. This process, called atherosclerosis, is dramatically accelerated by high blood sugar. Over time, it can lead to heart attacks, strokes, congestive heart failure, or even sudden cardiac death. What makes this worse for seniors is that some common signs of heart trouble, like shortness of breath, fatigue, or mild chest discomfort, are often dismissed as just getting older. But these symptoms should never be ignored, especially if you have diabetes. So what can you do? First, make sure your doctor is not just checking your blood sugar but also monitoring your blood pressure, cholesterol levels, and heart function regularly. These are all critical risk factors. Second, embrace a heart-healthy diet. That means cutting back on saturated fats, processed foods, and high-sugar snacks, and increasing your intake of vegetables, lean proteins, omega-3 fatty acids, like those in salmon or flaxseed, and fiber. Regular, gentle exercise, even a 20-minute walk a day, can significantly improve heart health. Third, don't ignore medications if prescribed for heart protection. Drugs like statins, ACE inhibitors, or low-dose aspirin can be life-saving when used under medical supervision. Finally, know the red flags: sudden dizziness, chest tightness, pain in the neck or jaw, or unexpected fatigue. These could be signs of a looming heart event and require immediate medical attention. Your heart doesn't have to become another victim of diabetes, but only if you act early. This is one of the most dangerous yet most preventable complications of diabetes. Number 2. Diabetic kidney disease, nephropathy, the silent filter failure. Your kidneys are your body's natural filtration system. Every day, they filter nearly 50 gallons of blood, removing waste, balancing fluids, and keeping your blood pressure in check. But if you're a senior living with diabetes, these powerful organs are under constant attack, and you might not even know it. Diabetes is the leading cause of kidney failure in adults. This condition, known as diabetic nephropathy, happens when high blood sugar slowly damages the tiny blood vessels inside the kidneys. Over time, these vessels become scarred and leaky, making it harder for the kidneys to do their job, until one day, they stop working altogether. What's frightening is that kidney damage usually develops silently. You won't feel pain. You won't notice changes overnight. In fact, many seniors don't realize they have kidney disease until it's already in stage 3 or 4, when symptoms like swelling, fatigue, or changes in urination become more obvious. But there are early warning signs, if you know what to look for. One of the earliest indicators is a condition called microalbuminuria, where small amounts of protein start leaking into the urine. Left untreated, this can progress into end-stage renal disease, requiring dialysis or a kidney transplant to survive. Here's what you can do to protect your kidneys. 1. Regular testing. Ask your doctor for 2 specific tests every year. Urine test for protein, albumin-to-creatinine ratio. Blood test for kidney function, eGFR, estimated glomerular filtration rate. These tests can catch damage before you feel anything. 2. Blood pressure control. High blood pressure and diabetes together are a dangerous duo. Aim for a BP of around 130/80 mmHg unless your doctor advises otherwise. 3. Limit salt and processed foods. Too much sodium stresses the kidneys and raises blood pressure. Watch out for canned foods, deli meats, and salty snacks. 4. Stay hydrated, but don't overdo it. Sip water throughout the day to support your kidneys without overloading them. 5. Take kidney protective medications if prescribed. Medications like ACE inhibitors or ARBs are often given to diabetics to protect kidney function, even if your blood pressure is normal. Your kidneys may be quiet, but they speak loudly through your lab results. Don't wait for symptoms. Get tested, stay alert, and take early action to protect your filtration system. Number 3. Diabetic retinopathy and vision loss, the gradual thief of sight. Imagine waking up one day and realizing that your world has become blurry, dark, or distorted, not because of age alone, but because diabetes has silently stolen your vision. This isn't a rare scenario. In fact, diabetic eye disease is the leading cause of vision loss among adults over 60, and it's particularly dangerous for seniors who may already have other vision challenges. One of the most serious threats is diabetic retinopathy, a condition where high blood sugar levels damage the tiny blood vessels in the retina, the part of your eye responsible for capturing light and sending images to your brain. Over time, these vessels can swell, leak, or even close off completely. In more advanced stages, new abnormal vessels grow, which can bleed into the eye and cause severe vision loss. The real danger? You may not notice any symptoms at first. Vision loss from diabetic retinopathy is often gradual and painless. Many seniors don't realize anything is wrong until they start experiencing symptoms like blurry vision, floaters, difficulty seeing at night, or sudden vision changes, and by then, serious damage may have already occurred. And diabetic retinopathy isn't the only concern. Diabetes also increases the risk of glaucoma, a condition that damages the optic nerve due to increased pressure in the eye, and cataracts, clouding of the lens, both of which can develop earlier and more severely in people with diabetes. So, what can you do to protect your vision? First and foremost, schedule a comprehensive eye exam every year, even if you think your vision is fine. Ask specifically for a dilated eye exam, which allows the eye doctor to see the back of your eye and catch early signs of damage. Second, keep your blood sugar, blood pressure, and cholesterol within the target ranges. All three play a role in eye health and can worsen the progression of diabetic eye disease if left uncontrolled. Third, be aware of even subtle changes in your vision. If you notice blurred vision, dark spots, flashes of light, or trouble seeing at night, don't wait. Get checked immediately. Modern treatments like laser therapy, injections, and even surgery can help prevent or slow vision loss, but only if caught early. Your eyes are precious. Don't let diabetes rob you of the world around you. Alert number 4, diabetic neuropathy, nerve damage. the pain you might be ignoring. Have you ever felt tingling, numbness, burning, or sharp stabbing pain in your feet or hands, and just brushed it off as poor circulation or aging? For many seniors with diabetes, these aren't just harmless sensations. They could be signs of diabetic neuropathy, one of the most common and most dangerous complications of uncontrolled blood sugar. Neuropathy is a condition where high blood glucose damages the nerves, especially in the extremities. Over time, the nerves that help you feel touch, temperature, or pain begin to malfunction. You might feel nothing at all, or you might feel everything: pain from the slightest pressure, burning at night, or numbness that makes walking difficult. But the biggest danger isn't just the discomfort. It's what you don't feel. Seniors with diabetic neuropathy often step on sharp objects, develop blisters, or experience cuts and ulcers without noticing. These minor injuries can quickly become infected, especially when combined with poor circulation, leading to serious foot infections or, in severe cases, amputation. That's why nerve damage in diabetics is a life-altering condition, not just a minor nuisance. The good news? You can slow it down and even prevent further damage if you act early. Here's how. 1. Control your blood sugar. This is the #1 step in preventing or delaying neuropathy. The more stable your blood sugar levels, the less damage is done to your nerves. 2. Inspect your feet daily. Look for cuts, redness, swelling, or changes in skin color. Use a mirror or ask for help if you can't see the bottom of your feet clearly. 3. Never walk barefoot, indoors or outdoors. Always wear well-fitted, cushioned shoes that protect your feet from injury and relieve pressure. 4. Moisturize and care for your skin. Dry skin cracks easily and can become infected. Use a gentle moisturizer, but avoid putting lotion between the toes to prevent fungal infections. 5. Get a professional foot exam every year. Podiatrists can detect early nerve damage and help with special footwear if needed. And if you're experiencing symptoms like burning, tingling, or numbness, talk to your doctor. There are medications and therapies that can help manage the pain and protect your nerves. Neuropathy may seem invisible, but its impact can be devastating. Take action today before small symptoms turn into serious consequences. Alert number 5. Diabetic skin infections and slow healing, when a small wound becomes a big problem. For most people, a small cut or scrape is nothing to worry about. But for seniors living with diabetes, even a tiny wound can turn into a serious infection, sometimes with dangerous, even life-threatening consequences. That's because diabetes doesn't just affect your blood sugar. It also weakens your immune system, reduces blood flow, and slows down your body's ability to heal. When blood sugar levels are consistently high, the body struggles to fight off bacteria and fungi. Skin becomes dry, cracked, and vulnerable to infection. Even something as minor as a nick from a toenail clipper or a blister from a tight shoe can spiral into an ulcer, abscess, or cellulitis. In some cases, these infections spread to the bone or bloodstream, leading to hospitalization or amputation. Seniors are especially at risk because circulation naturally decreases with age. Combine that with diabetic nerve damage, which may prevent you from even feeling the injury, and it's easy to see why skin issues can go unnoticed until they become emergencies. So how can you protect yourself? First, inspect your skin, especially your feet, legs, and areas between your toes, every day. Look for redness, swelling, warm spots, cuts, or signs of infection. Second, keep your skin clean and moisturized. Avoid harsh soaps and apply a gentle lotion daily to prevent cracking, but don't use it between your toes. Third, avoid walking barefoot, even indoors, and wear comfortable shoes that don't rub or pinch. Fourth, manage your blood sugar, as high glucose fuels bacterial growth and delays healing. And finally, if a wound isn't healing within a few days, or seems to be getting worse, don't wait. See a healthcare professional immediately. When it comes to your skin, prevention and early attention can save your limbs and your life. Alert number 6. Diabetic hypoglycemia, low blood sugar shock, a sudden and dangerous drop. Most seniors with diabetes worry about high blood sugar, and rightly so. But what many don't realize is that low blood sugar, also known as hypoglycemia, can be just as dangerous, if not more. It can come on suddenly and escalate into a medical emergency within minutes. Hypoglycemia occurs when your blood sugar drops below 70 milligrams per deciliter. This can happen if you skip a meal, exercise more than usual, take too much insulin, or mix medications improperly. And for seniors, especially those taking insulin or certain oral diabetes drugs, the risk is significantly higher. The symptoms can start off mild, shakiness, dizziness, sweating, or hunger. But if not treated right away, it can progress quickly to confusion, slurred speech, blurred vision, seizures, or even loss of consciousness. In some cases, severe hypoglycemia can mimic a stroke, or result in one. What's even more concerning is that older adults may not feel the early warning signs as clearly. This condition, called hypoglycemia unawareness, makes it harder to react in time. Here's how to stay safe. Know the signs. If you feel shaky, weak, dizzy, anxious, or suddenly irritable, check your blood sugar immediately. 2. Keep fast-acting sugar nearby. Glucose tablets, a small juice box, hard candy, or a tablespoon of honey can raise your sugar quickly. Always carry something with you, at home and on the go. 3. Eat regular, balanced meals. Don't skip meals or delay eating, especially if you're on medication. 4. Review your medications with your doctor. Some drugs may increase your risk of low blood sugar, especially as your body ages. 5. Let family and caregivers know what to do. In an emergency, they need to act fast. Hypoglycemia doesn't give you much time. Learn your body's signals, prepare for the unexpected, and never ignore even the smallest sign of low blood sugar. Alert number 7. Combined effects and complications. When everything starts to connect. By now, you've heard about 6 serious, potentially life-threatening complications of diabetes, affecting your heart, kidneys, eyes, nerves, skin, and blood sugar levels. But here's something even more alarming. These issues rarely happen in isolation. In fact, for many seniors, multiple complications appear at the same time, creating a dangerous web of interconnected health problems. For example, nerve damage in your feet may prevent you from noticing a wound. That wound may become infected, and if your circulation is poor due to diabetic heart disease, healing slows down, and before you know it, you're facing a foot ulcer that puts you at risk for amputation. Or consider how kidney disease and high blood pressure can feed into each other, making both conditions worse, and accelerating damage to your heart. This is why doctors urge seniors to take a whole-body approach to diabetes management. It's not just about blood sugar anymore. It's about protecting your entire system, your organs, your nerves, your eyes, and your overall independence. Don't wait for warning signs to pile up. Managing one complication helps reduce the risk of others. Everything is connected, and your early action can change the outcome. If you've made it this far, you've taken a powerful step toward protecting your health or the health of someone you love. Diabetes is not just about blood sugar, it's about your heart, kidneys, eyes, nerves, skin, and your ability to live independently as you age. These 6 complications are common, dangerous, and often ignored until they become emergencies. But they don't have to be your future. The truth is, most of these conditions can be prevented or managed with early detection, regular checkups, a healthy lifestyle, and consistent monitoring. Your doctor can be your best ally, but only if you know the right questions to ask and the right symptoms to watch for.